Okay, good afternoon, everybody. Thank you for joining us for a special edition media briefing here on Facebook Live. We have a new format for you today, and really it's because of the spread of COVID throughout the community. We want to make sure that everybody's safe, and this is a very safe way to do it. So we're going to make it available not only to the media, but also to the public here as well to be able to watch and see what we have to say. So we're going to start out here with Health Commissioner Jeff Cooper, and he's going to have a little presentation, and then we'll continue on from there. So Jeff, take it away.
Thank you, Dan. Good afternoon, everyone. On behalf of Public Health and our Board of Health, we'd like to thank our partners for participating in this news conference today. I think it's really important based on what we are observing across this community and across this state that we work together to impart a sense of urgency about what we need to do as a community to limit the spread of this virus. It's very clear, and we're all listening to the governor, and we review the Ohio Public Health Advisory System map. It's very clear what's transitioned across this state over the last month. And so as of now, 56 counties are at risk level 3 red. Montgomery County remains one of those red counties. 30 counties are at risk level 2 orange, and only two counties in Ohio, in the eastern part of the state, are at risk level 1 yellow. That being said, all counties, and this is for the first time ever, all 88 counties in this state exceed the CDC high incidence threshold or high incidence rate of more than 100 cases per 100,000 population over the past 2 weeks. And so it's very clear what's happening. We have significant and oftentimes serious spread of this virus, which tremendously increases the exposure risk of individuals as this virus spreads. Montgomery County, if you look at our data, over the past month or so, our test positivity, meaning for the total number of tests conducted on individuals, those that turn out to be positive, that test positivity value has increased significantly. We were hovering around 4% positivity. We are now close to 9% test positivity. And if you look at our entire West Central planning region, all 8 counties, Champaign, Clark, Darke, Greene, Miami, Montgomery, Preble, and Shelby counties, that test positivity ranges from a low of almost 6% up to almost 20%. And so that's a very concerning position as far as public health is in interpreting the data. And so we want to talk to our community today about things that we need to do and need to be aware of regarding limiting the spread of this virus. Our incident rate is 366 cases per 100,000 population. That's the highest incident rate we have had for this virus since the beginning of this pandemic. And so that statewide advisory system, there are many indicators that are tracked in there, and we are trending in the wrong direction for many of those indicators. I think it's important to also discuss when we're talking about community spread. Obviously, there are many ways that this virus spreads. So we know that we have nursing homes, we have congregate locations, we have our K-12 schools. What's happening though in our schools is of a positive note. Our schools, our K-12 schools, are not key drivers of the spread of this virus. Our schools have done an outstanding job of developing their plans and adhering to the protocols and making sure that they're doing everything that's required in the orders, even above and beyond, to protect students and faculty. We're having community spread because of what's happening outside of the schools and what's happening in social settings. So, quite frankly, we have to come to recognize that in too many situations, individuals are not wearing a face mask. We're not social distancing, so we're dismissing the 6-foot distance that's needed. And we continue to see an increase in social activities. So game day watch parties, large wedding receptions, crowded bars, house parties, extended family gatherings. All of those social settings are why this virus is spreading, and individuals are not complying with the recommendations or dismissing the recommendations around masking and social distancing. And so many of us may say, well, gosh, we look at the statewide map and hey, if all 88 counties exceed the high incidence rate and 56 of the counties are already red and 30 are orange, well, there's really nothing we can do. And that's where I think it's important that we as a system of partners dismiss with that notion, because there are things we can do. And so it's really about social distancing, wearing our mask, washing our hands, covering our cough, staying home when we're sick, etc. Those are foundational tenets that we've been talking about from day one in this pandemic. And we need to reinvest in getting that message out and making sure that we're doing our part as individuals as well as organizations to limit the spread of this virus. Because ultimately what happens with community spread is that it ultimately ends up that there's a disproportionate impact to minority communities and marginalized populations, and most at-risk and vulnerable individuals who then are severely affected by exposure and infection with this virus. So many individuals, healthy individuals, may be asymptomatic, etc., or may have mild symptoms and disease, but we need to think of ourselves as an entire population. And it's incumbent upon each of us to protect the most vulnerable and the most at risk. So clearly there are things we can do as a county. We've talked about those, about the masking, the distancing, making sure that we're avoiding social gatherings. We understand that it's going to be difficult as the holidays approach, but we really need to revisit the basics of limiting the spread of this virus. So that's a quick update from Public Health about where we stand with respect to the data and what's trending in our county and across this state. And with that, I'd like to turn it over to Mayor Whaley.
Thanks, Commissioner Cooper, and certainly I'm grateful for your and your team's amazing leadership through this. What are we on? Are we now on month 8? Month 8 of this pandemic. And so I think Commissioner Cooper's points really drive home what is going on here. You know, look, we're looking at a state with a nearly 9% positivity rate. You know, that's the highest we've ever been. We have the highest number in this state. Every day we seem to break records on new cases. And across the country, we know earlier this week, 100,000 new cases every single day. So I know I'm very tired of the pandemic, and I know you are too, but we simply can't let up because lives are at stake. And so we really, especially as we get into these winter months, we're asking everyone to consider not going to, to friends' houses, to stay within what I call your COVID pod, to wear, I'm in this room alone, but to wear your mask when you're in a room with anybody that you're not living with, and to make sure that you do your part to pass up on these social events. And I know it's difficult as we're getting into the holidays. It's going to be hard, but we need to make sure that we're doing our very best because we're trying to save the lives of ourselves and others. So that's where we're seeing, as Commissioner Cooper said, we're seeing the spread. Well, it won't hurt if I just go watch the Buckeyes over at my friend's house. It's no big deal. It is. Oh, it won't hurt if I just grab this and hang out with someone I hadn't seen in a while. It's really, you must wear a mask and do 6 feet of distance, or better yet, do what we're doing right now and go on Zoom. That's what we're imploring the community to do. As Commissioner Cooper said, we've learned a lot more about this disease than I think back our first meetings in March, our first days in March. We know that schools are incredibly low risk, and we know that our schools are doing everything they can to keep people safe because they've learned a lot, keeping people in distance, making sure they wear masks. And it turns out kids are really good at following the directions about mask wearing, almost better than adults. So we want to make sure that we have that ability to do that. We also have to recognize that really what's happening on the spread is things that we really don't have to do. And so please, Dayton, Montgomery County, the counties surrounding us, we're imploring you for your community, for the safety of your family, and for the safety of yourself. Do what the CDC asks. Wear a mask in public. Wear a mask when you're not with your COVID pod. Create social distance, at least 6 feet of space, always and forever. And please, please follow these guidelines, especially during this month of November. it's important also because we want to make sure that we have the tools to fight this disease as a community. And that's why we always invite, and she's always here, is the executive director of the Greater Dayton Area Hospital Association. Some very important places for us in public health are hospitals, and we want to protect and make sure that should people get sick, they have the access and care they need. And so with that, I'm going to turn it over to Sarah Hockenbrock.
Mayor Whaley, thank you so much. Commissioner Cooper, thank you as well for your leadership and your partnership. To our media partners who are with us today, thank you for your willingness to join us via Zoom and work together so that we can prioritize everyone's safety. I think this is one of the ways that we can collectively demonstrate that we have to start making some of these decisions again that we were used to making in March and April when we were under isolation and quarantine orders. We have to return to some of that same sentiment and protect one another and each other and our families. And so, as Mayor Whaley mentioned, my name is Sarah Hockenbrock, and I have the pleasure of working with our region's hospitals through the Greater Dayton Area Hospital Association. And we are again seeing a new peak in hospitalizations across the region based on the data that our hospitals report to us in the Ohio Department of Health. What's changed in the last few weeks since we spoke? Unfortunately, hospitals have now treated double the number of COVID-19 patients in just the last month. So from October to November, we have treated double the number of COVID-19 patients. And we are now seeing that corresponding increase of patients who need to be treated in the intensive care unit, and some who even require ventilator use, more so again than what we saw in September and October. I don't want to alarm you because our hospitals are still safely managing to care and treat all of the patients who come in and seek care in this community, whether they're coming in for COVID-19 or anything else. But the trend that we have seen in the last month is disturbing, and we are now entering the flu season. Testing with our region's hospitals has confirmed that we have seen at least the first couple of seasonal flu cases right here in the Dayton and Miami Valley region. Our hospitals have continued to plan and prepare for the flu season, just like we do every year. But as I think everyone knows, this year is nothing close to the ordinary. We have this added layer of COVID-19 that we have to balance with our traditional flu season that will run through really November, December, January, and February, maybe even into March. And all of that has to be managed on top of the care that our hospitals normally provide to the entire community. You know, and I know that our hospitals are committed to caring for everyone who comes in contact with them and providing the high quality care that's needed. But in order to do so safely for the next several months, when we expect to see even more COVID-19 cases emerge all across the country, we need your help. And we need you to work with us and work in partnership with the Public Health Department to recommit to some of the lessons that we've learned since this pandemic began. This spread of COVID-19 can't continue in our community without having implications that impact all of us. So if we work together, we can actually slow the spread of this virus, we can slow the transmission in our communities, and we can protect the integrity of our hospitals as well as the frontline staff that we absolutely have to have ready to treat you, whether you're coming in for something related to COVID or you're coming in because of a car accident, something traumatic, or for something joyful, even to celebrate the birth of a baby and welcome new life into this community. And so we felt it was really important today for you to get to hear from someone actually involved in treating COVID-19 patients. So you're not hearing from someone like myself who serves in a nonprofit in an administration role. We want you to hear directly from a care provider. And so I'm pleased to welcome Dr. Stephen Burdett from Premier Health, who has been on the front lines of responding to this pandemic and treating COVID-19 patients since this pandemic began. Dr. Burdett.
All right, thank you, Sarah. Again, my name is Steve Burdett. I'm an infectious disease physician at Miami Valley Hospital. I'm also the medical director of infection control here at Miami Valley. And over the last 8 months, as Mayor Whaley said, I have been down in the trenches having probably cared for over 1,000 patients, either directly or indirectly through the team of physicians and nurse practitioners that we have employed here at Miami Valley Hospital to manage our COVID patients. The numbers don't lie. October was far and away this, if not the busiest, the second busiest month since COVID began. You know, July was very busy for us here at Miami Valley Hospital. You know, we get a lot of transfers from other facilities, so sometimes our case rates here are a little higher than even what's going on in the community. But October, it was just every day we were admitting new patients. Again, what we saw here in the hospital definitely matched what is being reported in the news and in the literature in terms of rates. You know, at this point, we see patients, almost, I would say 80% of the patients that come into the hospital are previously diagnosed. So they went to see an urgent care, they went to the ER, they went to their family provider, they had the test done, it came back positive, and then unfortunately they had progression of their disease and had to seek care within the hospital. What we see inside the hospital also matches what is talked about in the media and in just in the news, and majority of folks have minimal to no symptoms. They don't feel well, they might have some cough, the loss of taste and smell, classic. And we see that, I've seen that more now than I've seen in my 15 years as an infectious disease provider. Perhaps it's because I ask that question more, but that is something that we definitely see with this virus that was not classic with other things. So people go to their docs, the testing is being turned around efficiently, they're getting the diagnosis, but for most folks, there really is no treatment, and it's just supportive, and you have to watch for progression. And the big progression that we watch for is increasing shortness of breath. So if somebody is having a harder time breathing, they get up to do something, get a cup of coffee or whatnot, they're having a hard time breathing, that's probably a time when somebody needs to go seek further care to see if their oxygen levels are really low. So again, almost all folks, or not almost all, but a majority of folks, minimal to no symptoms. I've seen dozens or heard from dozens of people who tested positive who have zero symptoms. So that does happen, okay? But you still have to do everything you can to prevent it, because we see people every day who have moderate symptoms. They're on a fair amount of oxygen. Majority of these folks have medical issues. So they have the diabetes, they have high blood pressure, they have obesity. But we also see people that are completely healthy who are now on a lot of oxygen just to try to keep their levels up, just to get through it. So just because you're young and healthy does not mean that if you get COVID, you're just going to breeze right through it. Chances are you will, but those people every day are in our hospital fighting for their life, to basically. So we see some of those, and then a small percentage of folks are the sickest of the sick. And these are folks that are on ventilators. And again, I've been doing this 15 years. I spend a lot of my time in the intensive care unit taking care of infections. And we're used to those type of infections. The things that we see with COVID is very different. The ICU infections that this thing causes, or the ICU symptoms, these patients are on ventilators for way longer than we see with influenza, way longer than we see with normal pneumonia. I mean, people can be on the ventilators for weeks and weeks and weeks. We try not to put them on the ventilator because it is very hard to get them off of the ventilator. So we do some different maneuvers to try to keep their oxygen levels up without putting them onto breathing machines. And that can last for weeks, sometimes longer, okay? So yes, you might be healthy. Yes, you may not have any medical problems, but you can give it to somebody who has those issues, or you may be one of the small percentages of folks that gets the severe manifestations. And predicting who gets the severe manifestations is very hard, because it is at the literally at the microscopic level based on your body's receptors. And there is no way to know whether you have a lot of the receptors and therefore at risk for complications, or you have a low number of receptors and you're at minimal risk. We can't tell that. We can't do a blood test to determine that. So the best thing we can do, prevention is the key for this. Treatment-wise, I do hear a lot of patients trying to get steroids. That is kind of the new thing. Steroids work for people who require oxygen. If you are a patient who is not on supplemental oxygen, steroids could actually make your disease worse, okay? So please talk to your provider, but steroids, most people have heard of the steroid prednisone. Something like that is reserved for people who require oxygen supplementation, oxygen support. And then in some of those folks, there may be a role. The drug remdesivir has been talked about a lot in the media. Many of you guys have heard about it. Honestly, we give it. It's expensive. We still give it. And I'm not sure that it's not the end all. It does not kick in and all of a sudden make you better if you get remdesivir. We see people every day who get the entire course of remdesivir and it didn't change their oxygen requirements at all. Okay. So again, do what you can to avoid the infection. Avoiding it is the best thing possible. Improvement with COVID. Some people reach that point after 5, 6, 7 days of feeling really bad that boom, they get better. Most folks, it's not that way, especially in folks that require very high amounts of oxygen. They just very gradually see a decrease in their oxygen requirements. And again, it's not unusual for people with COVID that have it severe to be in the hospital for 4 weeks before they're on a low enough amount of oxygen that they can get out of the hospital. And then going on just what some other folks said, again with influenza, flu is not here yet in great numbers. You will see an occasional case. I pray that we are like Australia and Chile and Argentina, who have seen basically no influenza, one because of vaccination, but also because masking will also help with influenza. It is a similar type of disease spread with the droplets. And so if we're wearing our mask, we can prevent influenza. The problem is when I talk to patients, a majority of patients have that social event that has been mentioned by everybody so far, where they were not masked. They got together to go out to drinks to watch the Ohio State game. They had 8 people over for some sort of activity. They had a retirement party and they wore masks all the time, but they didn't at the retirement party. And so almost everybody, now there are still people that we see that you can't figure out where they got COVID, but a majority of folks say, you know what, I was at a bonfire, I hugged 5 people, we were doing whatever, and we were not masked. Masking works, social distancing works. Is it perfect? No, but it's really good and it can make a difference. But the problem is we don't do it enough. And the last thing I will say, and I'll turn it back to Dan and to Jeff, is you just can't let your guard down. I know we're all sick of masks. I'm like Mayor Whaley, I've got my mask right here. I hate it. The masks that we have to wear have little frizzies that break off inside and they tickle the inside of your nose and you're always touching your face, which is the last thing you want to be doing with COVID, but they do work. I am in a COVID patient's room multiple times a day. I don't wear a big fancy PAPR. I don't wear a big fancy prevention stuff. I wear this mask, a fresh one, this mask with my eye protection, with my gown and my gloves. And I have not caught COVID, even though I'm literally around it every day. So masking will work, but it only works if we're wearing it. So thank you.
Okay, thank you, Doctor. That was some great information there. At this point, we're going to open it up to our members of the media who are joining us here for any questions you may have. We ask that you identify yourself also to the viewers so we know who you are and who you're with.
I guess I'll start. I'm Tino Bovenzi with Spectrum News 1. This is a question generally for anybody. This could be for Mayor Whaley. How do you prevent your messaging from sounding like a broken record at this point? Because this is, you know, like you said, month 8 of this, and people may just be defying orders because they're tired, as you said, of wearing masks, social distancing. They want to get back to normal life. So how do we make this message hit people at home to take this to heart?
Well, I'll start. And I thought the doctor's message was, thank you, doctor. It was so good. And the whole point about how well these masks work is really something that we didn't really understand at the beginning of this pandemic, that we really, really understand now. So, I mean, I want to drive that point home. And listen, you know, you didn't see a lot of us over the summer. You didn't see us coming to you nearly every week like we are now. And while we are very on message, as you said, Tino, I think that's why you like us, right? Is that we do, you know, are consistent about what we're saying, and that hasn't changed. but we're coming to you more urgently now because of just the rate. And it's not just what Commissioner Cooper is saying, or the doctor's saying, or Sarah's saying. You only need to look at the numbers and know we are in deep, deep trouble. And that if we don't start really changing our behavior to really tighten up, we're gonna have some problems in this community. So, I mean, I think that's really the difference here that we're saying. Number one, the doctor's message about how well masks work. And number two, like, don't take our word for it, look at the numbers. That is very, very serious. And we need people to start paying attention to that again.
Mayor Whaley, Aaliyah Williamson from WDTA.
Hey, Leah, just a second. I think Commissioner Cooper wanted to say something else about that, and then we'll get to you. It's good to see you.
Good.
Thank you, Mayor Whaley. Yes, I concur with what everyone said, and I get it. We get it at Public Health about not sounding like a broken record, and it's just the same message over and over. But I mean, let's face it. It's about us as individuals. As human beings that care about each other, making personal sacrifices to protect each other and the ones we love. And if the worst thing that ever happens to us as an individual is that we have to wear a mask, I mean, think about that. Life's pretty darn good, and we're pretty fortunate in life. If the worst thing that we ever have to do is say, gosh, I had to wear a mask in public. Seriously, that's not worth complaining about.
Okay, Leah.
Great, thank you. I just wanted to ask Mayor Whaley, is there any potential for future mandates or shutdowns with the way that we're trending?
Look, we'll do what we need to do to protect hospital capacity. So I'm going to be really clear about that. Right now, we're fine. Elective surgeries are still going on, but this community is going to do what it needs to do to protect hospital capacity. Is that right? Do you disagree with me, Commissioner Cooper?
No, we're in complete agreement.
Okay, I just want to be clear. Commissioner Cooper, I really don't move without Commissioner Cooper, so I wanted to make sure he's agreeing with me.
Well, I have a second question. This is my last one. I just wanted to ask, the election just ended. Are we tracking or tracing any outbreaks from election lines or anything of that sort, or are we pretty much in the clear?
Go ahead, Commissioner.
So I think it's too early to know that right now. We do not have any data at present that indicates any type of spread as a result of voting during the election. But really, it's too early to tell that. Well, let's keep in mind right now our 7-day rolling average on new cases per day, about 122 new cases per day in Montgomery County. So we'll see over the next several days and week what that really looks like and how many individuals we need to identify as close contacts and what those venues were where they were exposed.
I have a question.
Wait,
sorry.
Fred.
Did you want to add anything?
Yeah, Tino wants to go for. He had his hand up. I was just gonna say.
I just wanted to ask what the exact positivity rate was. You said close to 9%. Is that 8.7, 8.8, 8.9? Just that specific detail.
For Montgomery County, it's 8.8 currently, and that's updated once a week. So early next week, we'll get the new percent.
Bryn.
All right, my question is for Sarah. Sarah, what do you have to say about how hospitals have had to rearrange their floors in the last month to fit more COVID patients? And then at what point will our hospitals have to potentially start shipping patients out if it ever comes to that point?
So that's an active part of our emergency response planning, whether it is for COVID-19 or if we had a massive train accident or derailment, if we needed to shift patients and move them around in our community, we have the collaborative relationships and the response plans to do that. And currently the role of our hospitals is to be prepared and ready to take care of anyone in our community, whether they're COVID-19 or not. And so we're adjusting the physical infrastructure and capacity on almost all of our facilities to make sure that we have the necessary physical infrastructure, but also making sure that we're collectively taking care of staff that are the most critical infrastructure that we could possibly have to take care of those patients who would be coming into any bed, whether it's a COVID bed in a COVID unit or somewhere else in the hospital. So those are normal components of what we have to do for right now. but certainly what you're seeing in other parts of the country, that's where we do not want to end up as a region.
And if I could add on to that just a little bit, I would just encourage people that do have COVID just to realize that just because you have COVID does not mean you need to come into the hospital. Again, we would like to save the hospital for people who require supplemental oxygen, who are having other issues. Some people with COVID just don't feel well. If you're evaluated in the emergency department and found to have good oxygen levels, you can walk around and your oxygen levels are okay. There may not be a need to put you into the hospital to take up a hospital bed. So I would just like folks to have an expectation of, if you don't feel well with COVID, it's very reasonable to be evaluated. And I'm not discouraging that, but I would like folks not to have an expectation that everybody with COVID who doesn't feel well needs to be in a hospital bed for several days. Many people can be fine at home, but again, seek a medical evaluation.
Hey there, Molly Koick here with WHIO. So what I'm hearing right now is a lot of guidance and a lot of encouragement for people to wear masks and to social distance and things like that. And Aaliyah just asked about any sort of potential mandates. Mayor Whaley, you talked about doing what needs to be done to stop the hospitals from becoming overwhelmed and to keep the community safe. So when is it that the city or that the county will in fact take action and put in place new mandates? What is the threshold for that?
Commissioner Cooper, do you want to take a stab?
Sure. So we are in routine communications with the other urban health departments across this state. We have a weekly call with Governor DeWine to report out as a community and as a county and state what's happening on the grounds. And so I think we want to make sure that as we're all trending in the same direction, undesired direction together, we need to recognize that this virus does not recognize political or geographical boundaries. And so it may be that as this virus continues to spread, as more and more counties transition to risk level 4 purple, I think those are the type of situations by which we begin to discuss what additional restrictions are going to be needed. Yeah, but the key is we're not there yet, and we can reverse this trend by doing the things that every presenter here has talked about.
And what are the restrictions, the potential restrictions that you're looking at?
I'm not going to speculate on potential restrictions. Yeah, I don't think that would help anybody. I think we should focus on what we need to do based on what we know right now. Yeah.
And then I do have one more question as well. So there's a lot of chatter on our social media pages about, increased positive tests, but also it appears that we are doing more tests. So can you speak to that relationship between the increased tests and then the increased positive tests as well? Are we only seeing more positive tests come back because we are in fact doing more testing? Can you clear that up?
I don't know that we truly know if that's the case, that we're seeing more positive test results because more testing is occurring. I think the virus, we're seeing more spread because of individuals not masking and not social distancing, et cetera. Certainly as more and more different types of tests become available, as we increase our capacity around rapid antigen testing, we also have the potential to see a significant increase in test positivity. That's one component, but clearly the virus is spreading because of our individual actions and the lack of social distancing and masking, et cetera, and avoiding large crowds and gatherings. Yeah.
And I'll just add from a clinical standpoint within at least our hospital, when the community rates are down in the low single digits, our COVID unit, our high-risk respiratory unit numbers tend to trend down. When our rate gets up into the 9% or so, as we track that even within our own internal lab, when those numbers go up, we expect our census to go up, and a few days later, it's not immediately, because again, so many folks are being tested on an outpatient basis. It's if I on Monday see a rate that goes up significantly, I mentally start preparing for 5 to 7 days later, we're going to see the increase on the inpatient side. So we definitely see it and feel it here, that as the rate goes up for positivity, the hospital numbers go up as well.
I have another question. So the big message here from what I take is about self-accountability, but also accountability on the end of making sure that people are wearing masks. Obviously, during the initial mask mandate, people were told not to, be the mask police. The police aren't being the mask police, that public health would cite people if necessary, but that strategy seems to not be working. So where do we go from here as for accountability and making sure that we keep people, putting a mask on and keeping it on in public settings when they can't social distance?
Let me start and then I'll go to Commissioner Cooper. I think I think this is actually, I disagree with your position on it. In the city of Dayton, we actually see pretty good coverage of masks in public spaces. And we've been impressed. And when people do have an issue, they do email me, they talk to the public health department. Like, we have been managing through, the use of masks, and when people don't wear them. And people do, we work to compliance. That's the way we work enforcement, is enforcement to compliance. And that has not been an issue like it has been in other counties across the state. However, what we're seeing, and I've said this to the governor, is we're not seeing the spread happen in schools or in public spaces. We're seeing the spread happening, like the doctor said, at a watch party for the Buckeyes, or a bonfire where I may drink a little bit and tend to touch people too much and get too close, right? I forget my social distancing guidelines. That's where we're seeing the spread. So this is not something that, if we're really gonna buckle up here, it's gotta be in your home and with your family and friends. And that's not something we can legislate, and not something that we can be on. You have to make that choice for yourself and for your community and for your family. And that's what we're asking everybody to do. That's where we're seeing the spread. And that's why we need people to do the right thing here. Commissioner Cooper.
No, I agree completely. We're not seeing increased numbers in cases being reported and significant community spread because of what's happening in our K-12 school facilities. That's not the case at all. And businesses, for the most part, are doing a really good job to comply with the orders. It's about personal accountability for us as individuals, as family members, to make sure that we're doing everything we can to limit the spread of this virus in social settings.
And if I can add, it doesn't have to be a confrontational conversation. It can be a matter of simply asking the people that you're thinking about getting together with on Saturday night, are we going to be outside? Can I bring a couple extra lawn chairs so that we can space out and make sure that we can spend time together, but be fully distanced? By the way, it's really serious for us. We're going to all be wearing our masks, and we'd really appreciate it if you guys would too, because we want to make sure that we all are healthy in the next couple of weeks. And so it doesn't have to be a contentious or confrontational conversation. It can really be a matter of making sure that we're doing what we can to protect one another and raise awareness at the same time.
And I'll just add a little bit more onto that. So as we look at something like the holidays that are coming up, like Thanksgiving, that this cannot be a year where you put 20 people at a 10-person table and you're sharing 3 people on 2 seats and everybody's eating, because one of the highest risk things that we have is, or I'm bad just like everybody else, I talk while I eat, and that's going to increase your droplet spread. So you're going to have to, if you're going to have a small gathering, if you're going to do something like that, you're going to have to get folding chairs, and you're going to have to spread people apart, and they're going to have to eat with a plate of food on their lap. If you have to get together, you cannot put everybody at one table and not expect to have issues. Because again, a lot of folks are either asymptomatic with the virus, or they're contagious today, but they're going to have symptoms 3 or 4 or 5 days from now, and they can spread the virus. So if you have to get together, you're going to have to figure out the logistics so that you can keep your distance, keep your spacing, to protect everybody there.
I guess one more, how close are we to moving to purple? I know we've been in red for a long time. A lot of the counties are in red. What's the, I guess, how close is that mark?
I don't know that we can answer that. Ultimately, the state tracks the indicators. I don't know that there's anything that stands out for us as a county that's unique that would say we are more at risk of transitioning in the immediate future prior to any other county that has a similar rate to us. So there are 7 indicators tracked in the statewide advisory system, but we really aren't going to know until we get that little pre-notice from the governor's office and the Ohio Department of Health prior to his Thursday news conference. I wish I could tell you that, but I just don't have that information.
Are there any specific areas in the county that are doing significantly better or significantly worse?
That's a good question. So, we track the data from a zip code standpoint. And if you look at the zip code maps on our webpage, many of the I would say early on, yes, there were fewer cases in some zip codes compared to others, but now we're just seeing more and more community spread. And so I would never say that one particular zip code now is at much less risk than another zip code because of the way this virus spreads and the way individuals are interacting socially in the community.
Another component of that, I think it's really important to recognize, is that we don't just live or work or stay or shop within our own zip code. And so we might go across the entire county to go from home to work. We may cross into another county to go run errands and go shopping. And so that transmission is what we're seeing all across the entire region. And that's why I think we're asking people to be thoughtful, not just for citizens of Dayton and Montgomery County, but we're looking at this as the broader Dayton region to make sure that we're all doing what we can to prevent that community spread and transmission.
Okay, with that, one last chance for any more questions, and I think that will wrap it up for today, unless any of our panelists have any further thoughts they want to end with.
It's great to see you all from afar. Stay safe and stay
Yeah,
well.
I kind of like this.
Bye-bye.
All right. With
I
that,
would just like to add that I wish we had more definitive answers to some of the questions, but unfortunately some of this is just unknown right now. But I think it's really important that we focus on the messages that you heard from each of the presenters today, because we know what to do to limit the spread of this virus. We know exactly what to do, and we can access and analyze all the data we want all day long, but it really doesn't change what we need to do as individuals. And so let's adhere to those foundational tenets that we've learned from day one of this pandemic, and let's do this together. We can limit the spread. We can minimize the spread of this virus by working together.
Go Dayton.
okay, with that,
My last comment is get a flu shot.
Yeah,
Dr.
absolutely.
Burdett.
Absolutely.
we have them
I got
available.
mine, Dr. Burdett. I got it.
Yeah.
Okay, thank you for joining us here on this edition of Facebook Live here with Public Health. Be sure to follow us to find more updates coming soon. Thanks for joining us.